Alex, my name is Dana. I had my surgery in Houston, and as soon as I had it, I went directly after my surgery. I went directly into cognitive therapy, I guess what you would call it.
Yeah.
My big issue is facial recognition.
Mhm.
It's hard for me to see someone and recognize them,
Mhm.
and so I went through all these different tests where I had to name people. I saw their face and I had to remember their names,
Mhm.
like 30 people at a time. And I did that for like, I don't know, 3 months on and off, maybe once every week.
Mhm.
And it was very helpful.
Oh, good. I'm glad to hear that.
I start
Uh,
I started learning tricks to remember. And
yeah,
so and they called it speech therapy, but it was different than the speech therapy I got here in Atlanta.
right.
Here I got learned how to eat, but there I was like learning how to use my brain.
Yeah, yeah, that's awesome. I'm so glad to hear that that was helpful for you. Yeah, so and another good point is that speech therapy in many cases is kind of a misnomer because, you might be learning how to eat. You might be doing cognitive rehabilitation. So it just kind of depends on the practice setting and the qualifications of um the provider, of course. But yeah, so that is a great example of how you are able to learn strategies and techniques to compensate for a neurological change in functioning.